7.
It's back to the classroom for physical therapy students, but under strict procedures to protect everyone from COVID-19. This is Maryland Medicine Frontline News. Coming up, an update on the hunt for a vaccine with Dr. Kathleen Newsel of the Center for Vaccine Development.
We are well advanced for a pathogen that we only discovered 7 months ago.
We'll also learn how the 3 C's can save your life and the life of someone living in a nursing home.
Have you been exposed to anyone with COVID-19 or suspected COVID-19 in the last 14 days?
Social distancing is mandatory outside the Allied Health Building, where students undergo a multi-step screening process for COVID-19 before they're permitted to enter.
Are you currently experiencing any of the following? Cough, shortness of breath or difficulty breathing, fever, chills, muscle pain, sore throat, or new loss of taste or smell?
The screening protocol was designed under CDC and university guidelines and requires that temperatures be taken prior to entry.
97.5.
Students are limited to groups of 3. With cameras and microphones in every classroom, instructors can carry out the lessons remotely.
One of the things when you're talking about balance, patient safety is of the utmost importance.
The students were motivated to come in and finish their classwork, their labs. As all physical therapists, we work with our hands and we work with people, and we need to be able to practice on each other.
Our job is so physical, so hands-on, that it's really hard sometimes to tell, is someone giving the right amount of pressure to the patient? Are they applying their hands in the right way?
Yeah, you need to get your hands on people. And if you can't do that over Zoom, and right now we're doing a lot of, picking patients up, moving them around, getting them walking, and you can only be by the book so much, but it is helpful to move people.
With the number of coronavirus cases surpassing 3 million in the U.S. this week, Dr. Kathleen Newsel is hopeful that a vaccine will be ready soon.
We expect the first phase 3 study to start in the United States at the end of July. So again, we are moving along extremely well in the clinical development process. That vaccine is an mRNA vaccine manufactured by Moderna. And here at the University of Maryland School of Medicine, we will be part of the testing of that vaccine as part of the phase 3. Dr. Karen Kotloff is the principal investigator for that trial. And that will actually tell us, it'll tell us more about the immune response to the vaccine, more about the safety of the vaccine. But importantly, what a phase 3 study does is tell us if it can prevent COVID disease.
It's clear that the pandemic is not over. It's not even slowing down. We see what's happening in the South and the Southwest. It is ramping up. We're fortunate in this part of the country, Maryland and some part of the East, where it is slowing down a bit. But we must be vigilant. I would just encourage our entire academic community that we cannot let up at this time. We have to follow the public health guidelines. They're not very complicated, but they're all we have. And they can be very, very helpful in staving off a rapid rise in our infection rate.
Understanding the 3 C's can help keep infection rates low in the community and in nursing homes where the risk of infection and death is great.
The 3 C's that we need to think about when deciding whether an activity will put us at risk are crowds, closed spaces with poor ventilation, and close contact, particularly with conversations. People spread it through droplets, be they large droplets or small droplets. And those droplets are generated when people breathe heavily, they talk, they shout, they sing. Any of those things generate these droplets that can lead to transmission of COVID-19. The risk of infection to nursing home residents at this time is the risk that a staff member will become exposed and infected in their community. And so a lot of what I have done in talking to our staff members is have them understand the 3 C's. If they can understand the 3 C's, then they can reduce their risk of infection in the community and prevent themselves from spreading COVID-19 in the nursing home.
You can stay up to date by visiting the Coronavirus Update page on the School of Medicine website. Until next week, I'm Larry Roberts for the University of Maryland School of Medicine.